Schizophrenia, presented by Donna Mendoza, Saskatchewan Polytechnic, Regina, Saskatchewan. Continuing Education Fall, Nursing 106, Mental Health, Leslie Sparling, due date August 19, 2023. What is schizophrenia? According to Public Health Agency of Canada, schizophrenia is a psychotic disorder that can affect the way a person interacts with and understands the world. Moreover, it is characterized by significant impairments in perception and changes in behavior as stated by the World Health Organization. Additionally, it is a serious mental illness that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality, which can be distressing for them and for their family and friends, as defined by National Institute of Mental Health. Although the exact cause is unknown, there are several predisposing factors that could lead a patient to have schizophrenia, such as biological factor, which includes genetics. The risk of schizophrenia is increased in biological relatives of persons with schizophrenia. Environmental factor is another factor, like exposure to toxins, perinatal complications like viral infection, poor nutrition, hypoxia, or poor neural development. And lastly, the neurobiological factors, which includes dopamine theory. The dopamine hypothesis of schizophrenia states that too much dopamine in the brain or too little could directly contribute to symptoms of schizophrenia such as delusions, hallucinations, and disorganized thinking. Epidemiology in Canada. 1 out of 100 were diagnosed with schizophrenia. 56% men and 44% were women. About 30% were aged 20 to 34 years old as newly diagnosed. The mortality rate was 2.8 times higher than those not diagnosed with schizophrenia. Schizophrenia usually progresses through predictable phases, although the presenting symptoms during a given phase and the length of the phase can vary widely. There are 3 phases of schizophrenia, which are the following. Phase 1, acute. The onset of disruptive symptoms such as hallucinations, delusions, apathy, and withdrawal, with reluctant loss of functional abilities. In this phase, increased care or hospitalization may be required. Phase 2, stabilization. Symptoms are decreasing and there is a return of previous level of functioning. Day hospitalization or care in a residential crisis center or a supervised group home may be needed. Phase 3 is the maintenance. The person is at or nearing baseline functioning. Symptoms are absent or decreased and level of functioning permits the person to live in the community. Most people in this phase live in their own residences. Symptoms of schizophrenia varies from one person to another, and some symptoms are also found in other disorders, such as postpartum psychosis and substance-induced psychotic disorder. Hence, it is crucial to thoroughly assess a patient with the presenting symptom. Positive symptoms are those that occur in addition to normal experiences. First, there are delusions, or strong false beliefs that the client might feel very strongly about, even if there's strong evidence against it. Second are hallucinations, or perceptions of something in the real world that's not really present. Another symptom is disorganized speech, which occurs because these individuals have difficulty controlling their flow of thoughts. Lastly, there's grossly disorganized or catatonic behavior, which can manifest as repetitive movements, unusual actions, bizarre posture, and not responding to other people's instruction. However, negative symptoms represent the absence of normal behavior, and the most common are called flat affect and anhedonia. Flat affect manifests as decreased facial expressions like frowning and smiling, reduced eye contact, and decreased speech intonation. In addition, anhedonia is defined as the inability to enjoy pleasurable activities. Cognitive symptoms, on the other hand, are the most evident symptom in patients with schizophrenia. These patients may present with cognitive problems such as the inability to focus, impaired memory, and decreased ability to solve problems, or mood symptoms such as depression, anxiety, and suicidal ideations. The diagnosis of schizophrenia is based on the client's history and physical assessment. Diagnosis is confirmed using the Diagnostic and Statistical Manual for Mental Disorders, 5th edition, or DSM-5 criteria, which is a set of diagnostic criteria indicating the symptom that must be present and for how long to diagnose a mental health condition. According to the DSM-5 criteria, schizophrenia is diagnosed in clients who present with at least 2 of the following symptoms over a 1-month period, such as delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, or negative symptoms. All those diagnosed with schizophrenia exhibit at least one of these symptoms and with a significant impairment in functioning for at least 6 months. However, laboratory testing can be additionally used to assess if the patient is intoxicated, while imaging methods like MRI and CT scans can be used to exclude the presence of tumors in the central nervous system, which could potentially cause similar symptoms. Neurotransmitters involved in schizophrenia. Neurotransmitters are chemicals that allow neurons to communicate with each other throughout the body. And there are 2 brain chemicals, which are dopamine and glutamate, that carry messages to cells along brain pathways that doctors believe control thinking, perception, and motivation. Dopamine is a neurotransmitter that plays a role in pleasure, motivation, and learning. It is linked to hallucinations and delusions in schizophrenia because brain areas that run on dopamine may become overactive. Glutamate is a chemical involved in the part of the brain that forms memories and helps us learn new things and tells parts of the brain what to do. One study found that people who are at risk for developing schizophrenia may have too much glutamate activity in certain areas of the brain at first, and as the disease progresses, those brain areas may have too little glutamate activity. Patient profile. Name: Nathan Smith, age 21 years old, a medical student at University of Regina, gender: male, culture: Metis, community: Regina, living arrangement: family home, diagnosis of schizophrenia, history of psychobiological disorder, new onset, comorbidities: anxiety, existing social support. He had stopped seeing his friends for more than 6 months. Nursing process. For the assessment, therapeutic communication skills is a vital component to promote quality patient care by establishing rapport with the patient. Here are 2 quotes that will demonstrate the therapeutic communication of a nurse. I do not hear the angry voices you are hearing right now, but they must be terrifying for you. Conveying empathy is crucial in building trust with the patient, thus promoting successful nurse-patient relationship and quality patient care. Another one is, I have noticed that you are not socializing with your friends like you used to be. Has something happened? I am here to support you. Encouraging communication is a significant skill to build a therapeutic relationship with the patient. Always ask the patient to make clear what is going on to obtain baseline data and provide accurate care. Nursing process. Nursing diagnosis: disturbed thought processes related to alteration in neurological functions as evidenced by hallucinations. Treatment goal: by discharge, the patient will verbalize decreased episodes of hallucinations. Nursing intervention: explore possible actions that can minimize anxiety and reduce hallucinations, such as whistling and reading aloud. Decrease environmental stimuli such as low noise and minimal activity. Ask the patient if he has supplements or herbal preparation at home as part of their culture to control the auditory hallucinations, and educate him that it can interfere with the effectiveness of the prescribed medication. Evaluation. Goal met. Patient demonstrated decreased episode of hallucinations and learned to deal with hallucinations like whistling and singing. Treatment outcome: patient will learn ways to refrain from responding to hallucinations. Second, diagnosis: ineffective coping related to lack of sufficient behavior as evidenced by patient verbalized inability to cope and handle stressors. Treatment goal: acquire sufficient behavior and skills to meet goals and solutions to problems. Nursing intervention: the use of cognitive restructuring, relaxation techniques including music therapy and deep breathing exercises, and group therapy as coping strategies were discussed with the patient. Encourage family members and friends to provide support. Refer patient with the local Schizophrenia Society support group. Evaluation: goal partially met. Patient verbalize coping mechanisms such as "I will listen to calming music and take deep breaths when I feel overwhelmed." Treatment outcome: patient will be able to apply a variety of anxiety reducing techniques on his own. Pharmacological intervention: antipsychotic medications work by altering brain chemistry to help reduce psychotic symptoms like hallucinations, delusions, and disordered thinking. They can also help prevent those symptoms from returning. Olanzapine, brand name Zyprexa, Zyprexa Zydis. It is an atypical or second-generation antipsychotic agent. It is used to treat schizophrenia and certain types of bipolar disorders. It's also used in combination with an antidepressant to treat depression that can't be controlled with other drugs. Olanzapine isn't approved for treating psychosis that's related to dementia due to increased risk of death in seniors ages 65 years or older. Olanzapine can cause a condition called drug reaction with eosinophilia and systemic symptoms, which is called DRESS symptoms, which includes rash, fever, and swollen glands. Avoid alcohol because drinking alcohol while taking olanzapine increases risk of orthostatic hypotension. If you drink alcohol, talk with your doctor about whether this drug is safe for you. Community support groups. Support groups can promote a sense of connection and community and may help a person with schizophrenia better cope with their condition. There are 3 community support groups in Regina who can help Mr. Smith in coping with schizophrenia. 1. Schizophrenia support groups provided by Schizophrenia Society of Saskatchewan. Another one is mental health, adult mental health clinics, individual counseling provided by a Saskatchewan Health Authority. Third one is mental health promotion, which is also provided by Saskatchewan Health Authority. Furthermore, there are 2 crisis interventions that could help him and his family toward crisis resolution, which are the Mobile Crisis Services with telephone number 306-757-0127. Helpline 811 is another crisis intervention resource. If you're having technical issues with accessing Helpline 811, you can call 1-877-800-0002 to be connected with Helpline 811. Thank you.